So let's start with histamine 3. Okay? So histamine 3, sorry, ayan. So this is a GI-linked receptor. Okay, histamine 3, even histamine 4 receptor. These are GI-linked receptor. Okay, so GI-linked. Again, including histamine 4 receptor. Okay, now recall that uh, kapag GI-linked ang isang receptor, it induces inhibitory effect. Okay, it induces inhibitory effect. Now, for histamine 3 receptor, for its location, they are most dominantly, galag no, kadali lang. They are most dominantly found in the presynaptic neuron. That is why naamoy makita diri sa ubos. Pasensya kayo galag. Okay, nasa ubos, the neuron. Okay, that actually symbolizes presynaptic neuron. Okay, so sulat na ko ha. Number 1, niya nga location. And again, mostly pronounced or most dominant ang number of histamine 3 receptor na makita sa presynaptic neuron. Okay, presynaptic neuron. Okay, and then recall nga ang mga receptors that are located in the presynapse, kapag ang receptor located sa presynapse, di ba, they are considered as autoreceptor. If you can still remember, autoreceptors, they are considered autoreceptors kapag ang receptor is found on the presynapse. So somehow na mo idea for the effect kapag na-activate ang H3 receptor, isang autoreceptor, okay, in the presynapse. So kapag na-stimulate ang histamine 3 receptor in the presynapse, there will be autoregulation. And ano yung ibig sabihin ng autoregulation? Di ba pag sinabing autoregulation, there is inhibition of further release of that particular neurotransmitter. So in this case, there will be inhibition of further release ng histamine. Okay, resulting therefore to decrease histamine level that is available for action. Again, that is because of the autoregulation nga effect. Diba? Dumdumi always, pag sinabing auto-regulate, you are regulating something, so you are inhibiting, okay, in here, the release of a particular neurotransmitter kapag auto-regulation. So since we're talking about H3, histamine 3 receptor that is found on the presynaptic neuron, so inhibition ng further release ng histamine. So, end result, mababa yung levels ng histamine available for action. Okay, again ha, most dominantly found ang H3 receptor sa presynaptic neuron. Naakay makita diri nga figure also na makita si H3 receptor in the small intestine. Okay, so that's number 2. Sa ileum, particularly in the ileum part, okay, ileum part of the small intestine, the activation ng H3 receptor, that leads to decreased pressure or decreased contraction ng walls in the small intestine. So kung decrease ang pressure, decrease ang contraction sa small intestine, that results to constipation. Okay, constipation naman yung result dito. Again, because of the activation of histamine 3 receptor in the ileum part of the small intestine, there is constipation ultimately. Okay, then in the heart, sa heart naman, So inhibitory, take note, inhibitory man iyahang effect overall. So there will be, sa heart ha, there will be a negative chrono. So you know already what is chronotropy. That has something to do with the heart rate. Okay, decrease yung heart rate. Negative also ang ino. Okay, the inotropy. Inotropy, yun yung strength or the force of contraction. Okay, so negative, negative, negative chrono, negative inotropy. That's for the effect kapag na-activate ang histamine 3 receptor present in the heart. Then in the lungs, there will be ventilation. Okay, ventilation will be at ease. Okay, at ease yung ventilation, so there would be bronchodilation. Okay, bronchodilation. Okay, hala. Okay. So please take note of the following location ng histamine 3 receptor. But again, the most pronounced location ng histamine 3 receptor is the presynapses. Okay, the presynaptic neuron. Then finally, for histamine 4 receptor, nasa sa taas. Okay. Ayan. So for histamine 4 receptors, they are mainly expressed naman on certain cells, okay, that are usually involved sa inflammatory responses. So those cells nga involved sa immune or inflammatory responses. Okay, so example, yung mast cells, no? Immune cells ng mast cells, di ba? Muna nga to ang symbol sa mast cell. So this is actually mast cell. Okay, so kapag na-activate yung histamine 4 receptor, it could lead to activation also ng mast cell. So there would be release as well ng histamine. Okay, then also histamine 4 receptor are present at high levels on bone marrow. Okay, so ito naman is for the bone marrow, particularly on the hematopoietic cells ng bone marrow, yung mga related sa blood cell production, di ba, sa bone marrow man na siya. Okay, so that's it for histamine 4 receptor. So meron din sa ileum. But again, yung focus nyo lang is for histamine 1 and histamine 2 receptor. Kaya ang mga drugs, again, nga i-tackle later on, has something to do or they target histamine 1 and histamine 2 receptor. Okay? So overall, that is all about histamine receptor subtypes. So we are done with receptor subtypes. For the next slide, this is only a tabulated form on the information that was discussed earlier sa previous na figure about receptor subtypes. Okay? So ganun pa rin, si histamine 1, they are specifically found in the smooth muscles, usually on the vascular endothelial cells in the heart as well in the CNS. Take note, GQ linked or GQ coupled receptor ang H1. Okay? Then what is the effect sa let's say sa vascular endothelial cells? There would be increased permeability, di ba, of endothelial cells. Okay? Then for histamine 2, asa man siya much more dominated ang histamine 2 receptor, di ba? Much more widely distributed siya sa parietal cells, di ba, ng stomach. Parietal cells ng stomach. Muna siya iyahang main location. Okay? This is also a G protein coupled link, particularly GS link siya. Ano yung effect kapag na-activate yung histamine 2 sa parietal cells, sa release of gastric acid. So yun lang yun, na-discuss na siya, tanan. Okay? Then histamine 3, mostly found in the CNS. Yung sabi ko kanina, sa presynaptic neuron. Okay? They are mostly found in the presynaptic neuron, particularly in the CNS. So GI linked naman siya. Okay? And what is the effect? Auto-regulation. Okay? Auto-regulation. Then for H4 receptor, okay, peripherally found sa hematopoietic cell ng bone marrow. This, for some references, this is considered GI link. Okay? But again ha, ang ato alang focus yun more is on H1 and H2. That is why, because of the effects no ng H1, activation of H1 receptor, di ba, mostly kapag na-activate yung mga histamine 1 receptor in numerous cells, it triggers allergic reaction. What are examples of signs and symptoms ng allergic reaction? But there is bronchoconstriction, difficulty in breathing, there is pain and itching, there is a redness. Okay? Usually, ang redness nga gaka-feel ana because that is because of the vasodilation, okay, ng blood vessels. Okay? And recall nga sa smooth muscles, sa vascular smooth muscles, there is vasodilation na nangyayari kapag activated yung H1 receptor. Okay? So, this is also the reason nga nung ang usual drugs nga atong madiscuss later on are anti-histamine 1 receptor. Okay? Anti-histamine 1 receptor na mga drugs that is used for the treatment, okay, for allergies. Then for histamine 2 receptor, since ang effect kapag na-activate yung histamine 2 receptor, they increases the release of gastric acid. So tataas yung HCl level na ay tendency na with prolonged increase secretion ng HCl in the stomach that might lead to stomach ulcers, hyperacidity. So naatay mga treatment like H2 blockers, no, para matreat ang stomach ulcers. So common nga atong drugs nga ma-encounter is mga blockers of this histamine receptors, mga blockers. Kasi again, yung mga effect nila somehow brings a negative, more siya negative ang dating ba ng mga effect. Okay? So we have to counteract those effect upon activation of this histamine 1 and 2 receptors. Okay? So let us now proceed to the drugs. Starting with, okay, histamine agonists. Okay, for histamine agonists, we only have two, but yung una, yung synthetic histamine, again, we're talking about here synthetic histamine. Yung produced or manufactured in the laboratory. Okay, synthetic. Synthetic histamine is no longer used nowadays. Okay, kaya nakalagay dyan, obsolete use. Okay, again, histamine, synthetic na histamine, no longer used. Okay, lagay nyo sa notes, no longer used. Pero before, unsa di ang use aning synthetic histamine. Kung ano yung effect ng histamine sa katawan, particularly upon activating, let's say, histamine 1 receptor. Kapag merong histamine na nakapag-bind sa histamine 1 receptor, ano yung effect nito sa pulmonary vascular smooth muscles. Diba? There is bronchoconstriction. That is why ginagamit siya before as pulmonary function tests. Okay? Mura siya provocative test, kumbaga. Provocative test from the term itself. Iyahang gina-provoke niya ang certain organ, particularly the bronchial smooth muscles, para ma-test, ma-determine how well the bronchioles is functioning. Okay? Kung unsa ka well-functioning ang pulmonary smooth muscles. Okay? So, iyang ga-induce siya og bronchoconstriction via administering histamine. But again, this is no longer used. Okay? Then another thing, kapag histamine nakapag-bind sa histamine 2 receptor, take note, di ba? There is gastric acid secretion. But there is gastric acid secretion. So before, ginamit siya to determine the adequacy ng gastric acid secretion. Kung pila ka kadaghanon ang makaya sa stomach ng isang tao to produce gastric acid. Okay? So, iyahang gina-determine unsa kadaghanon ang kaya ma-produce sa usa ka tao when it comes to gastric acid secretion. Okay? But again, no longer used na siya. Ang useful karon nga histamine agonist, so kanila atong matakol nga histamine agonist. Okay, histamine agonist, we have betahistine. This is marketed under the brand name Circ. I think you're familiar with this. Circ ang iyahang brand name. Particularly, iyahang MOA, mechanism of action is it activates histamine 1 receptor. Again, it activates histamine 1 receptor. Okay, so kung na-activate ang histamine 1 receptor, what will happen to the bronchial smooth muscles? There is bronchoconstriction. These are actually side effects already. Remember, ang side effect that is related lang sa mismong effect ng drug. So, with prolonged use of that particular drug, okay, ang iyahan na da yung adverse effect, same lang sa iyahang effect. So, kung nag-cause siya bronchoconstriction, later on, magiging side effect din yan kung ma-prolonged na siya. Okay, excessive use, prolonged use na. Okay, then another thing, iyahang effect as well is enhanced capillary permeability. Okay, upon activating H1 receptor. Now, nakalagay dito, it also antagonizes, it blocks histamine 3 receptor. But bakit classified siya in general as agonist, histamine agonist, although meron siyang histamine 3 receptor blocking activity? Recall, ang histamine 3, asa gani siya dominantly found. Ang histamine 3, they are dominantly found in presynaptic neurons. Okay? So sa presynaptic neurons, ano yung effect kapag na-activate? Okay, let's have activation lang sa. Kapag na-activate ang histamine 3 receptor, di ba there is auto-regulation. Okay? Again, kung histamine 3 receptor activation, not antagonist ha, kung activation, diba there is auto-regulation. Ano yung effect kapag auto-regulation? Decrease ang histamine levels. So kung mababa yung histamine levels kung activation, that's a negative histaminergic activity. Okay? That is not part of agonistic property. Kung mababa yung histamine. We're talking about histamine agonist here, di ba? Kaninga slide, we're talking about histamine agonist. Dapat mataas yung level ng histamine available for action. Now, that is why, classified ni siya as agonist kasi sabi dito, antagonistic siya sa histamine 3 receptor. So, pinipigilan niya yung auto-regulation. Okay? So kung pigil ang auto-regulation, there would be, further release, continue ang release ng histamine. Okay? So taas yung levels ngayon ng histamine if it is classified as H3 receptor antagonist. So kung taas ang level ng histamine available for action, histaminergic, it will manifest histaminergic effects. Okay, lahat ng effects na associated to histamine 3 activation. I mean, blocking. Okay, histamine 3 receptor blockade. Okay, so taas yung histamine. Okay, again we're talking about the histamine 3 antagonistic effect sa presynaptic neuron. Okay? So pigil ang autoregulation, net effect, taas ang histamine. Okay? Now, ano yung main use or clinical application ng beta histamine today? Okay? So ginagamit siya, useful siya in the management of vertigo. Okay, ginagamit siya in the management of vertigo. Kabalo man taon sa vertigo, no? Kanang bitang feeling of dizziness. Okay, kanang lipong-lipong. Kanang sensation of spinning. Kanang murag tuyok ang imuhang kalibutan. Okay, vertigo, kang gakahilo ka. Okay? So, yung problem kasi, underlying problem during vertigo, you have that loss of balance. Okay? You have that loss of balance. Why? Bakit nagkakaroon ng loss of balance during vertigo? That is, that occurs usually due to irritation in the inner part of the ear. Okay, yung inner part of the ear, connected man na siya sa inyong brain. Okay, that is actually very important to maintain balance. Okay, postural balance ba sa inyong body. Okay, so ang loss of balance ana occurs due to irritation. Okay, due to irritation in the inner part of the ear. Okay? Yan yung part, yung inner part of the ear, particularly yung part na ng ear nga very important or very much involved sa balance. Okay, kung mag-search mo sa Google inner ear, that is very important for balance. Okay? Now, bakit nagkakaroon ng irritation sa inner ear? Kasi there is constriction ng vessels in there. Okay, sa ear connected to the CNS, there is constriction, okay, of the blood vessels. Okay. Now, with the use of beta-histine, okay, recall nga ang beta-histine, pinapataas niyo yung histamine. Pinapataas niyo yung histamine via blocking histamine 3 receptor. So, marami yung histamine ngayon na magbabind sa histamine 1, no? Histamine 1 receptor. Okay? Aside from beta-histine itself, meron tayong mga histamine that are naturally produced, okay? That will also bind to histamine 1 receptor. Recall nga ang effect ni histamine 1 receptor sa blood vessel is vasodilation. Scanin niyo yung notes. Okay, sa vascular smooth muscles, particularly sa blood vessels, ang effect ng histamine 1 receptor activation is vasodilation. Kaya, with this vasodilating effect of histamine 1 agonist, yung drug na to will increase the blood flow in the inner part of the ear, thus restoring the normal balance, okay, ng posture ng tao. Okay, so pwede siya in the management of vertigo. So beta-histine, yan yung gamit niya for vertigo. Anti-vertigo na siya sa inyahang packaging. Yun yung mabasa. Okay, CERC, anti-vertigo. MOA niya, histamine 1 receptor agonist and histamine 3 receptor antagonist. So I hope naintindihan bakit classified as agonist si beta-histine, although meron siyang antagonistic property towards histamine 3 receptor. Okay, for some other students, ilaha siyang ma-misinterpret nila ba. Okay, antagonistic na ni ma'am, pero nga nung agonist siya. So that is the reason, because of blockade pala ng autoregulation. Taas ngayon yung histamine. Okay, so that is all about histamine agonists. Okay, histamine agonists. So let us now proceed to the antagonist, particularly histamine 1 antagonists. So diri na mag-start inyong pag-memorize sa drugs. Pero wala gyud memorize nga mahitabo good kay online pwede ra scan ang notes. So kuha na lang familiarize, no, ang mga drugs. Okay, so these are the following Before sa list of histamine 1 blockers, okay, we have generally two classifications of histamine 1 blockers. Natay first gen, second gen. Okay? First generation, second generation. Okay, nga H1 blocker. So nani sila differences when it comes to their characteristics. Okay, so for first generation H1 blockers, they are also known as classical or sedating H1 blockers. Okay, sedating because they are able to cross blood-brain barrier. Okay, BBB. Unsa man ang characteristic ni blood-brain barrier? Is it lipophilic or hydrophilic? You can type in your answer, ha? Okay, very good. It is lipophilic. Okay? So, it is able to cross blood-brain barrier because highly lipophilic yung mismong mga first-gen H1 blocker. Okay, highly lipophilic din yung characteristic nila, lipophilic. Okay, yung characteristic nila. That is why they could affect CNS. Diba recall, kapag naapektuhan, tinarget ang histamine 1 receptor in the CNS, kapag binlock ang histamine 1 receptor sa CNS, there will be sedation, there would be drowsiness nga ma-feel sa pasyente. So, first generation po nga mga H1 blocker, they are much more sedating compared to second generation. Okay? Another thing, a characteristic ng first gen, they have this atropine-like effects. You tell me, what is the classification of atropine? Is it a cholinergic agonist or cholinergic antagonist? Agonist or antagonist? Very good. Atropine is an antagonist. That is why, in some other references, first generation H1 blocker, they have that anticholinergic effects. Okay, they manifest the same effects, okay, ng mga anticholinergic drugs. Example, si atropine. Okay, again, they manifest atropine-like, kaya nga tinawag atropine-like, parehas ng effect kapag ginamit yung atropine. Okay, so yun yung isa sa natural nature ng mga H1 blockers, particularly yung mga classified nga H1 blocker as ethanolamines and ethylene diamines. So, unsaon man ninyo pagkabalo nga anticholinergic effects na siya. Naalala yung sa parasympathetic drugs na notes nyo, yung dumbbells, that is for cholinergic effect. Ang dumbbells, that's for cholinergic effect. So, ang inyo lang i-memorize, opposite of dumbbells. Okay? Kung ano siya, mnemonics. Diba? Ang D kay diarrhea. So, opposite ng diarrhea, there is constipation. Usually, kapag gumamit ka ng mga first generation H1 blocker, more siya side effect ba? Atropine-like ng mga side effects. So, opposite ng diarrhea, constipation, opposite ng urination, retention, diba? Urinary retention, opposite ng meiosis, midriasis, okay? Opposite ng bronchoconstriction, there is bronchodilation, etc. Okay, so opposite of dumbbells, yun yung anticholinergic effects. Okay? Now, for second generation naman, sila naman yung less sedating one. Okay, less sedating, particularly yung mga classified as piperazines. Okay? And napunta yung non-sedating, mga non-drowsy nga H1 blocker. Dili sila ga-cause og sedation. Okay? Kasi in some other persons, di ba, kanang mga gatrabaho, for instance, mga driver, mga piloto, example, allergy rhinitis. Of course, ang i-prescribe sa ilaha katong uh, anti-allergy nga drugs nga non-sedating. Okay? So case to case gihapon na siya nga basis na ikaw kung nara ka sa inyong balay gusto ra ka magtuluga, pwede ra gyud ka mag first gen. Okay, first gen H1 blocker. Okay? So that is for the general characteristics ng first gen and second generation H1 blockers. Okay? So let's start with first gen. So these are the list of drugs under first generation histamine 1 blockers. So na-classify sila based on chemical structure. Again, kani nga classification under first gen, including later sa second gen, naka-further classified sila based on chemical structure. So katong mga drugs nga sa ilang structure na ay naa sila'y main portion sa ilang structure na ethanol amines, yun yung diphenhydramine, dimenhydrinate, doxylamine, carbinoxamine. Okay? So again, ang ethanolamine as mentioned, stated sa prior nga slide, they are one of the most sedating. Take note, they are one of the most sedating. Okay? Nga H1 blockers. Also, they have that significant CNS nga anticholinergic effect. Okay, so take note, very significantly observed ani nga mga H1 blocker ang katong CNS anticholinergic effect. Okay? Anticholinergic effect. Okay? So that is for ethanolamines. Diphenhydramine, kung dili mo familiar sa iyaha, I think familiar mo sa iyang brand name, Benadryl. Okay? So Benadryl ang brand name ana niya sa market. So diphenhydramine marketed under the brand name Benadryl. Ang dimenhydrinate, this is the salt form of diphenhydramine. Again, salt form ni siya, salt of diphenhydramine. Okay? Diphenhydramine. Salt of diphenhydramine, ang dimenhydrinate. Okay? Doxylamine, this is marketed under the brand name Bendectine. Okay, Bendectine. Then Clistin naman yung carbinoxamine. Okay, now another subclass of first gen H1 blocker, we have those drugs containing ethylene diamines in their structure. Ethylene diamines sa ilahang structure. We have pyrilamine, tripylenamine. Okay. Then we also have piperazines. Okay, piperazines, we have hydroxyzine. Muning Iterax. Familiar mo sa Iterax? Muna siyang marketed under the brand name Iterax. Okay, di ba these are anti-allergy nga drug. Si Iterax, yung hydroxyzine, yes, meron na siyang H1 blocking activity. Now, in the body, okay, this is actually further metabolized to its active form. Nani siya active form? Yun yung cetirizine. Okay, cetirizine. Which is, meron din tayong, di ba, available nga anti-allergy nga cetirizine. Okay? Si hydroxyzine pala, isa siyang prodrug. Meron siyang prodrug ba ng cetirizine. Okay? And cetirizine, this is a second gen. Nasa sa inyong notes, second gen ni siya, second generation nga H1 blocker. So between hydroxyzine and cetirizine, between hydroxyzine and cetirizine, less sedating yung cetirizine kasi second gen man siya. Diba? Less sedating siya. Less sedating. Okay. We also have meclizine. Meclizine. Ito naman yung bonamine. No? Familiar mo? Kung magbiyahe, magbaon gud og bonamine. Okay? Para anti-motion sickness. Okay? Ayan. Cyclizine. Ito naman marketed under the brand name Marizine. Okay? Then we also have alkylamines, mga drugs in which ilahang structure merong alkylamine. Okay? We have brompheniramine and chlorpheniramine. So somehow, familiar mo ani, present ni sila sa mga cold preparation. Kaya sa sip-on, bitaw para sa sip-on nga mga preparation. Kakita mo chlorpheniramine maleate. Okay? Sige nga na. That's brom ha, kulang na siya M. Brompheniramine. Then we also have phenothiazines, particularly the promethazine. Okay, ito naman marketed under the brand name Phenergan. Okay, Phenergan. So para asa siya, nowadays ginagamit siya as pre-anesthetic agent. Okay, ginagamit siya as pre-anesthetic agent. And lastly, we have piperidine. Okay, specifically, we have cyproheptadine. Okay, cyproheptadine. Yung cyproheptadine, ginagamit siya naman for the management of serotonin syndrome. Okay, murag na siya somehow miscellaneous nga action or MOA. Aside from blocking H1 receptor, meron din siyang activity towards serotonin. Particularly, iyahang gina-inhibit ang release, na too much release ng serotonin. That's why nakalagay management of serotonin syndrome. Diba? Kung serotonin syndrome, sobrang taas ng serotonin level in the body. Okay, sobrang taas. So, ang gagawin ng cyproheptadine, meron siyang miscellaneous action as an anti-serotonergic drugs. So, isa siyang anti-serotonergic drug. Okay. So, these are the first generation histamine 1 blockers. Okay. So, kanaing mga heading ha, kaning mga heading A, B, C, kana sila mga classification nila based on chemical structure kung sa makita sa ilaha mga common structure per list of H1 blockers. Okay. Now, let's proceed naman to second generation histamine 1 blockers. Okay. So, we have piperazines. Sila yung less sedating group. Okay, less sedating. Okay. Bakit less sedating yung second generation H1 blockers? Bakit less sedating sila? Kasi yung characters nila, less lipophilic. Less lipophilic sila compared to H1 blocker. Diba sabi kanina sa mga prior slides, ang histamine 1 blocker highly lipophilic. So yung second gen, the reason bakit less lipophilic sila, less sedating sila, because lesser yung lipophilicity ng mismong group of drugs. So ang atong makita sa ilang structure are more on polar structures. Okay, so they are said to be polar drugs. Whereas kanina, yung first generation H1 blocker, they are non-polar, highly non-polar. polar. Okay? So under piperazines, we have cetirizine, so less sedating. This is marketed under the brand name Zyrtec. Okay, Zyrtec. Then we also have levocetirizine, a derivative of cetirizine. Then this group naman, yung piperidine, sila yung non-sedating group. Okay, non-sedating group. Okay, so example, we have loratadine. Okay, familiar na gid mo ani loratadine. This is marketed under the brand name Claritin. Diba? Claritin, ano siya sa advertise. Okay. Then we also have desloratadine. This is an active metabolite of loratadine. Active metabolite of loratadine. Katong during our time, katong nag-board exam ni, akong mnemonics good. Pero di na ko malimtan nga si loratadine mas makadungog loratadine non-sedating ka dili gid ka katulgon kay kani kanang lorat ang mata. Lorat ang mata, so somehow akong madumduman dili gid ko makatulog. Okay, so basing inyo siyang magamit para di pud mo kalimot. Okay, so mnemonics ra gyud na magdala sa ato. Okay, so fexofenadine is also a non-sedating second generation histamine 1 blocker. Okay, ito naman marketed under the brand name Allegra. Okay, so kani nga mga list of H1 blockers, kaning under sa piperidines, ito yung mga highly recommended for those customers nga ang ilahang occupation is kanang, for instance, drivers, ito pilots, di ba? So take note na ninyo. Usually for pilots, for drivers, and any other occupation nga kailangan dili sila katulgon. Okay? So yun. So again, these are the list of second generation histamine 1 blockers. So less lipophilic sila, highly polar na drugs. That is why lesser ilang ability to cross blood-brain barrier. Okay, less sedating ilang activity. So let us now proceed to the clinical applications naman. Clinical applications of H1 antagonists. Okay? And also later na yung H2 blocker. So let's start with the clinical application of histamine 1 blockers. So always na ko siya na-mention nga ang mga H1 blockers, sila yung for the treatment of allergic reactions. Again, sila yung for the treatment of allergic reactions. Okay? Kasi yung effect that has something to do or related to allergies is yung mismong effect upon activating histamine 1 receptor. So yung kailangan na gamot for the treatment of allergies are histamine 1 blockers. Particularly between first gen, second gen, most effective for allergic reaction are the first generations. Okay, the first generation. Okay, another thing, they can also be used in the management of Parkinsonism. Parkinsonism, this is actually a neurodegenerative disease. It has something to do with the imbalances ng neurotransmitter. Okay, particularly ang nangyayari sa Parkinsonism or patient with Parkinson's disease, mataas yung acetylcholine. Okay? Mababa yung dopamine. Okay? Yan yung nangyayari during Parkinsonism. Okay? Now, I have mentioned earlier na yung mga first generation, diba? Yung mga first generation H1 blocker, they have anticholinergic effect. Okay, they have anticholinergic effect. So somehow, yung mga symptoms, okay, yung mga symptoms that is associated upon increase of acetylcholine, 'di ba? Pag may mataas yung acetylcholine, ang gina-manifest ng mga symptoms would be cholinergic effects, cholinergic symptoms. Now, since ang first gen, meron siyang somehow anti-cholinergic effect, it can be used in the management of Parkinsonism. Okay? Another thing, pwede din sila for the management. Okay, not a specific nga H1 blocker for the management of EPS. EPS, that stands for extrapyramidal symptoms. Extrapyramidal symptoms. Okay? Now, ang common nga gakos o extrapyramidal symptoms are actually the group of drugs nga classified as antipsychotics. Okay? Antipsychotics. Okay? Sila gyud ang gakos og EPS. Okay? Unsa day ang usual manifestation ng patient with this EPS or extrapyramidal symptoms. Basta extrapyramidal symptoms, sawa kayo, sorry. We have 3 types, okay, of EPS. Okay, natay tulo ka manifestation nga makita, okay, or 3 types of EPS, okay, extrapyramidal symptoms that is caused by antipsychotics nga drugs. Una, we have akathisia. Ang akathisia, kung ano siya, kanabitong uncontrollable nga motor movements, uncontrollable restlessness, kanang di kapuyo, sige maglihok-lihok. Okay, akathisia. Second, pseudo Parkinsonism. So pseudo, it's a fake one, no? Parkinsonism. Dili gid katong real nga Parkinson disease, okay? Pseudo lang. Okay? Kasi, bakit pseudo Parkinsonism? It manifests the same symptoms to a patient nga merong totoong Parkinson's disease. Another is acute dystonia. Okay, acute dystonia. Ang acute dystonia naman, that is actually characterized by many symptoms. Okay, numerous symptoms. Pero ang pinaka-common nga manifested by patients with acute dystonia is yung medical term nga torticollis. Okay, torticollis. Kuha na siya. Meaning ana is twisting of the neck. Okay, twisting of the neck ang meaning ana. Again, this is one of the common sorry kaayo. Okay, sorry for that. Sige, so twisting of the Okay. Sige. So, twisting of the neck, yan yung meaning ng medical term na torticollis. One of the most common symptom ng acute dystonia. Okay, yung twisting of the neck, that is simply due to involuntary bitaw nga contraction ng neck. Iyahang association, mura siyag stiff neck. Okay, yung association kay mura siyag stiff neck. Okay, now, sabi dito, meron tayong H1 blocker used for the management of EPS. The particular type of EPS nga iyahang gina-treat or gina-manage is actually yung number 3. Okay. Yung number 3. Okay? Actually, halos lahat ng EPS, ang treatment are anticholinergics. Okay? Halos lahat ng EPS, yung listed, 1, 2, 3, anticholinergics ang ginagamit. But na isa dira, the only EPS not treated with anticholinergic is yung akathisia. Okay? Yung akathisia. The rest, anticholinergics ang ginagamit. But for, diphenhydramine, which is administered intravenously, ito yung drug of choice for acute dystonia. Again, yung diphenhydramine, ito yung drug of choice for acute dystonia. Okay? Or dystonic crisis. So, ayan. Kasi, di ba, diphenhydramine, this has a significant CNS anticholinergic effect. So, it can somehow produce a skeletal muscle relaxant activity as an anticholinergic. Okay? So, yan. So, ginagamit siya not because of its H1 blocking effect, but yung miscellaneous activity niya. Okay? As an anticholinergic. Next, another clinical applications, particularly of ethanolamines, itong mga list of H1 blockers under ethanolamines na chemical structure, ginagamit sila as sleeping aids. Okay? Example of a drug used as sleeping aid is yung Unisom. Unisom. This is a brand name. Nani siya available nga tablet or gel. Okay? Tablet or gel. And this may contain diphenhydramine or doxylamine. Okay? So, yung Unisom. So, ginagamit as sleeping aid. Okay? Then, we also have H1 blockers for the management of motion sickness. Yung meclizine. Yung meclizine ulit, yun yung bonamine. Okay? Anti-motion sickness. Then, we also have component of cold preparations ng mga H1 blocker. Kanang component sa preparation for colds, okay, treatment, we have brompheniramine and chlorpheniramine. So, yung mga alkylamines naman. Then, yung sabi kanina, yung Phenergan, yung promethazine, ginagamit as pre-anesthetic agent. And finally, na-mention ko rin kanina yung cyproheptadine because of its anti-serotonergic action. Pwede siya for the management of serotonin syndrome for its miscellaneous action. Okay, so that is for the clinical applications overall ng mga H1 blockers. Okay. Then, for its adverse effects ng mga histamine 1 blockers, of course, yung anticholinergic effect, sedation, particularly for histamine 1, first generation. Okay, first generation histamine 1. Okay. Then, yung take note ha, yung anticholinergic effect opposite of dumbbells. Then we also have a histamine 1 blocker that is considered cardiotoxic. Okay, cardiotoxic siya when combined with these enzyme inhibitors, terfenadine and astemizole. Okay? But good thing is, itong dalawa, they are already withdrawn. Okay? Withdrawn na sila from the market. Okay? They are already withdrawn from the market. Kasi, there are patients nga whenever, na mga cases pa, nga These antimicrobials, these are actually antimicrobials, terfenadine, acetazoles. Okay, when taken, when concomitantly taken with fexofenadine, okay, ilang gina-inhibit as an enzyme inhibitor, ilang gina-inhibit ang metabolism of fexofenadine. Okay, paano gina-inhibit nila nga enzyme, which is very important for the metabolism of fexofenadine. Okay, therefore, kung inhibited ang metabolism ni fexofenadine, taas yung levels niya sa blood. Tataas yung blood concentration ng fexofenadine. Kaya gina-inhibit man ang iyahang metabolism by these enzyme inhibitors, terfenadine and acetazoles. Okay? And with this cardiotoxic drug, musamot, di ba? Musamot, severe ang cardiotoxicity nga iyahang bring sa patient, and that leads to arrhythmias. Okay, so that is why gi-phased out ang terfenadine and acetazoles. Okay, aside from enzyme inhibitor sila, okay, gina prolong pud nila ang kanang part sa ECG, yung QT prolongation, okay, or prolongation. Okay. So ito yung actually main reason, underlying reason nga nung lead to arrhythmias ang patient. Sige lang, under cardiovascular drugs, inyong ma-learn ang theories or the physiology on QT prolongation, kanang ECG, etc. Okay, so these are the important adverse effects that you have to note under H1 blockade. Okay, so we are done with histamine 1 blockers. Okay, let us have histamine 2 antagonists. Okay, histamine 2 antagonists. So these are the 4 important histamine 2 blockers. Again, these are the 4 important histamine 2 blockers. And recall, kapag histamine 2, ang action is towards parietal cells. Ultimately, yung effect kapag binlock ang histamine 2 receptor in the parietal cell is inhibited yung gastric acid secretion. Okay. So again, we have the following H2 blockers: cimetidine, ranitidine, nizatidine, and famotidine. Among the 4, this is the most potent. Okay, most potent is famotidine. Cimetidine is the least potent one. Okay, least potent. Ranitidine, ito naman, marketed ni siya under the brand name Zantac. Okay, Zantac. Tak. Okay. Then, for nizatidine, we have an oral preparation. Okay? Siya lang ang H2 blocker na available only in oral preparation. Okay? This is available only in oral prep. Okay? So, ayan. Sige, let's have the clinical uses. So, dali na lang ni siya. So, since more on, di ba, ang ilang action is towards the H2 receptor present in the parietal cells, so somehow, related dito ang clinical application. So, we have the following uses of H2 blockers. Pwede sila gamitin for the management of GERD or gastroesophageal reflux disease. But please take note that the first line pa rin, the first line for GERD, management of GERD, is PPIs or yung proton pump inhibitors. Diba? Between PPIs, okay, versus H2 blocker, much more powerful, much more efficacious ang PPIs, knowing that PPIs is able to inhibit not just histamine, but also acetylcholine and gastrin. Those are mediators of gastric acid release in the stomach. Kasi H2 blocker, yung kaya niya lang i-inhibit is histamine, di ba? Histamine 2 blocker nga siya. So, ginablock lang niya ang histamine. Okay, histamine 2 receptor. Another is we have H2 blocker used for the management of acid peptic diseases. But again, the first line pa rin for acid peptic diseases, hyperacidity, is a proton pump inhibitors. What are examples of proton pump inhibitors? Katong ending in prazoles. Diba? Omeprazole, esomeprazole, lantoprazole, pantoprazole, etc. Okay? Then, first line naman siya. Take note, siya naman yung first line for the management of acute gastrointestinal ulcer bleeding administered intravenously. Okay? Then, ginagamit siya as adjunct. Okay? In the management of allergic reaction. Adjunct lang. Okay? Adjunct. Kasi yung kailangan talaga for allergic reaction is H1 blockers. Okay? So, pwede mag-take kag H1 blockers together with an H2 blocker. Yan yung ibig sabihin ng adjunct. Okay? So, there are certain cases. Alright? Then, for the adverse effects. Okay? So, take note, for cimetidine particularly, it is considered an enzyme inhibitor, thus causing enzyme inhibition. Okay? So, usually, naatay mga cases nga kailangan og monitoring, especially if a patient has comorbidities bitaw. Okay, let's say, ang patient is prescribed with an analgesic. Let's say the analgesic is codeine. Okay, this is an analgesic, codeine. Then the patient is said to take cimetidine as well for, let's say, for his or her hyperacidity. Okay? Now, you have to take note nga si cimetidine is isa siyang enzyme inhibitor. Okay? So, for codeine, si codeine kasi prodrug pa siya ng isang standard analgesic. Prodrug ni siya of morphine. Okay? Prodrug of morphine. Morphine is a standard analgesic, di ba? It is an opioid analgesic. And morphine is a much more active analgesic for codeine. Okay? Much more active metabolite ng codeine. Therefore, kung inhibited, okay, with concomitant use, concomitant administration of cimetidine plus a codeine, ang mahitabo, subtherapeutic lang ang mahatag or ma-offer ng mismong drug sa patient. Subtherapeutic. Okay, nganong subtherapeutic lang? Supposedly, si codeine has to be metabolized to its active form sa body, producing morphine, which has greater analgesic. Okay, na siya greater so may spelling sa analgesic. Ana man siguro, no? Di ko sure. Okay, analgesic, kamo na lang mag-correct. So, greater ang analgesic effect ni morphine compared to codeine. Now, with the presence of cimetidine, na siya tendency to inhibit, okay, the enzyme, okay, that is needed to metabolize codeine to its active form. So, kung ma-inhibit, okay, ang metabolism ng codeine to its active form, mag-retain lang siya to codeine. And codeine is lesser yung analgesic effect compared to morphine. That's why subtherapeutic lang ang ma-offer ng drug towards the patient. Okay, so that's why naa siya diri adverse effect ng cimetidine, enzyme inhibition. Okay, so meron siyang drug-to-drug interaction nga kailangan i-consider. Another thing, also for cimetidine. Okay, so cimetidine also meron siyang anti-androgenic effect, cimetidine, because it is able to inhibit the binding of this dihydrotestosterone to its androgen receptor. Ang pinaka manifestation ng anti-androgenic effect ng cimetidine is yung gynecomastia. I don't know if you're familiar. Gynecomastia. Muna siya among men, there is enlargement of breast. Okay? Enlargement of breast. Okay? Among males. Okay? So that is the adverse effect ng anti-androgenic effect ng cimetidine. Okay? And lastly, adverse effect also increase prolactin levels. Okay, increase prolactin levels or galactorrhea.